let's take a few minutes to get some comments or questions from the different sites. And as taking the prerogative as chair, can I ask Suit, who is site leader in Zero?
Thank you, Manuel. Can you hear me?
Yes.
Okay, thank you. Honorable Mary Robinson and two Deputy Minister, then Dr. Sweet from Thailand. I think we are talking about the long-term problem of the brain drain from European country. And we have to realize also the right of the workers to migrate, and at the same time, the power of the labor market. I have one question here, rather than proposing any solution. In the objective of this, the global video conference, objective number 4, to introduce the global framework for code of practice on health worker migration and engage stakeholders in its development. It's implied that we are going to finally end up with a code of practice on health worker migration, maybe approved by the World Health Assembly, or even if we want the member state want it to be stronger, it may go over even to an international legal framework. But before we consider that, I think we need to have enough evidence. The problem of migration of health workers lies in two main issues. First, the problem in the losing country. The country like, for example, African country, or in our region, Sri Lanka, want to maintain their health workers, particularly specialists and nurses, but they are losing. How can the code of practice help them not to lose? And second problem of migration is the bad treatment or inadequate treatment, unfair treatment of the migrant health workers in the receiving country. How can a code of practice help solve the problem of inadequate treatment or unfair treatment of migrant health workers in developed country? I would request that the WHO produce or provide concrete evidence, preferably published in peer-reviewed international journal, that inform us that a code of practice can make the difference before we start discussing the code of practice. As I understand that there have been a few code of practice existed elsewhere. For example, the Commonwealth Code of Practice. So I hope that Francis or Manuel can help the audience, the participants, or even maybe the Pepe can help provide this evidence so that we are convinced that we are embarking on something which is effective. Thank you.
Thank you very much, Suit, for those questions. Before we tackle them, can I ask Letitia in Kenya, do you have any comments at this point?
Thank you, Manuel. Now, I think we're just sitting here and everybody in the room, I've got a whole group of people in Kenya listening, and we're all shaking our heads and saying, so what's new? But I think the very important issue of ensuring that we have policies and we have strong public-private partnerships to address the issues and work together, training institutions, ministries of health, and we therefore tremendously thrilled about this discussion going on, and we certainly will be contributing in the next couple of days of discussions about it. Thank you very much for allowing us to be part of it.
Thank you, Letitia. So I guess with the time available, let's address the questions that Suit posed. And essentially, they boil down into two. The collection of evidence that actually leads to the question, can a code of practice actually make a difference, particularly in the losing countries and, of course, in the countries that receive these health workers? Maybe I might begin by saying, Suit, that really this evidence is being collected as we speak. And for example, in October of this year, there's going to be a meeting between WHO and OECD where countries will be presenting various case studies on migration and retention issues. Also, as part of this global dialogue, we will be hearing later on some of the experiences on the Pacific Code, and perhaps we could also listen from members in this forum at the moment on experiences on the Commonwealth Code. But thank you very much for those questions, because certainly you hit the nail on the head, that before we want to discuss this global code in the World Health Assembly, we better be sure what the evidence is that such a code is going to be helpful to all the countries. So with that, I guess maybe I can call on Jean Yan, who can make a general comment on these codes.
Just want to make a brief comment on the discussions that we have with the National Health Services in the UK regarding the experience on the code. They are now able to present and share with us both qualitative and quantitative data on the impact of the code. Apparently, they had two versions of the code. The first version, version of the draft of the code that they have been using, they're able now to share with us what was the real challenge in that. And they moved on to a revised one, an updated code, which is the one that's presently in place, and they will be also ready to share with us before the regional meetings about the positive responses and benefits to the code that they have started. And I don't know if Jorge would like to take a minute here to share.
I'm Dr. Jorge Mancillas, Health Officer for Public Services International. PSI represents 231 healthcare worker organizations in 154 countries, and collectively we represent 7 million health workers. And we are extremely interested in the development of a code for the following reason. It is our members, both in the source or origin countries, who are facing the very difficult dilemmas that lead to the decision of some of them to migrate to other countries, and our members in the destination countries are facing the impact of the negative pressure that employers are putting in their negotiating ability to defend their salaries and working conditions, of them having the ability to bring in migrating health workers who are vulnerable and have to accept, in many cases, lower salaries and worse working conditions than the domestic workers. What difference would a code of practice make? Well, we all know that a code of practice would not be enforceable at the national level, but many of our affiliates have used such international tools, their provisions and the data collected while they were being developed, to then lobby to get national enforceable legislation. And that's why many of our affiliates are asking us to work with all of you to develop such a code of practice. It's because it is an invaluable instrument. It has the weight of this global community. It has the weight of these institutions. It has the weight of have been adopted and endorsed by ministers of health at the World Health Assembly, if that is the outcome. And this added weight allows them to better lobby their legislators, their members of parliament, their governments to enact legislation which is enforceable and which is adapted to the realities of the country.
Thank you, Jorge. I guess at this point, can I call on Christian of ILO to make a comment from the point of view of the labor sector?
Good morning, good afternoon, everybody. Christiane Visco of the ILO. I think a very important issue to be addressed at country level, but also internationally, is, and it has been mentioned before in the discussion, this is an issue that cannot be solved by ministries of health alone. So how can we ensure that other ministries and other stakeholders that help and are important in implementing principles or whatever it is called at country level.